How do you know if your doctor accepts Medicare? And that's a question that I get pretty often, and it's really not a hard answer, but there are a couple different scenarios. So I'm going to go through that right now. I'm Keith Armbrecht, founder of Medicare on Video, and I help people across the country make the right Medicare choices. I'd certainly be happy to help you as well. And the great thing is there's no cost to allow me to help you. So hopefully you'll take advantage of all my information, and then I'd be happy to help you with your choice and make sure we get all your pieces in the right places. Right now we're going to talk about, does my doctor accept Medicare? And the different scenarios in this equation are you going to choose a Medicare Advantage plan, or are you going to stay on original Medicare? And if you've seen any of my other videos, you certainly know I'm not a fan of Medicare Advantage, but there's certainly plenty of people that are on Medicare Advantage. But if you are on Medicare Advantage, it's part of a private insurance company, and they have a network of doctors and hospitals. And generally, you have to stay within that network of doctors and hospitals. So if you want to find out if your doctor is in the network, you need to visit the site of that insurance carrier and do a provider search. And it will certainly be a more limited amount of doctors, limited amount of hospitals. Now, some Medicare Advantage plans offer a PPO type plan where they have an out-of-network benefit. So the doctor doesn't necessarily have to be in network. But I would certainly be careful in that scenario, because if you are going to try and go out of network in a Medicare Advantage plan, first off, the doctor has to be willing to accept you as a patient. And why they may not be willing to is because they know they're going to have to go to that private insurance carrier for payment. And they don't have a contract with them, so they have no control over what they're going to get paid. The other side of it is you as the patient need to understand that the insurance company is going to pay them less than what they're going to charge. So you're going to be responsible for the balance of whatever that provider charges that is out of network. So it can be very complicated. It sounds great when they talk about it, that you can go out of network and do what you want, but the cost is generally prohibitive, meaning it's just too expensive to use out of network. So it's still going to push you back to in network. So that's on a Medicare Advantage plan. On a Medicare Original plan, Part A and Part B, you can go to any doctor, any hospital in the country that accepts Medicare. So there aren't any restrictions. You don't have a network of doctors and hospitals. As long as they accept Medicare, you can go see them, and you can just call for an appointment. So we get to the point where, well, how do I know if the doctor accepts Medicare? Or how do I find a doctor that accepts Medicare or a hospital? It's pretty easy to do. And Medicare actually has a pretty good tool to do that. And I made a URL to make it easy for you to get there. Simply go to www.findamedicaredoctor.com, and it's going to bring you right to the page on Medicare where we do this. So we're going to go there right now. So go to www.findamedicaredoctor.com, and it's going to bring us right to the page on Medicare where we do that. And again, this is a pretty great tool, so it makes it very easy to do. And you can see right here, you can find a doctor or a clinician, a hospital, nursing home, home health, hospice, inpatient rehab, long-term care, dialysis. Everything's right here for us to find, and all we have to do is click. So we're going to start with doctor and clinician, and it's going to ask for your zip code. So where are you located? And I'll put in my zip code of 33706. We hit search, and it's going to bring up an entire list of doctors in the area. It's also going to have a map so you can see what's close to you, and you can do it by distance. This puts everything close to you in the beginning, and you can see here when we look at the map, you know, we have doctors in certain areas. This must be a hospital of some sort, or a practice where they have multiple doctors together. So it makes it very easy, and you can choose any of these doctors. And when you look at the list, you go down, and what we're looking at, all these doctors agree to the charges that Medicare provides. So they're going to accept Medicare. So they take Medicare assignment. So Medicare assignment means that regardless, they're going to accept what Medicare pays them as payment in full. Now, if you're on a Medicare Supplement Plan N, you may have heard about something called excess charges. And excess charges are where doctors who do not accept Medicare assignments. So Plan G covers excess charges, Plan N does not. But a doctor that does not accept Medicare assignment has the ability to charge you 15% more than what Medicare pays them. And I'll tell you, in personal experience, I've never run into a problem with this. I've never had anybody tell me that they've had a significant amount of an excess charge come to them, and especially when they have Medicare Supplement Plan N. We sell a whole bunch of Medicare Supplement Plan N. It's fantastic. If the premium makes sense, if it's that much less than Plan G, then Plan N works terrific. And the only thing that kind of gray is the excess charges. So when we're looking here, if we could find a doctor that does not accept Medicare assignment, it'll have an exclamation point instead of this dollar sign right next to it. And you'll see as we scroll down, it's hard to find one. And I'll go through the list, but for the most part, I think somewhere around 96% of doctors that accept Medicare assignment. So excess charges really doesn't play a part in it, but it's good to know that if we did have one with an exclamation point, they may send a bill that can be more than what Medicare pays them. But anything that I've seen in the past, it's been like $10 or $20. So it's not anything significant. And again, as long as the premium's low enough, and you can see here, I can't even find one that doesn't accept Medicare assignment. Every single one of them does. So hard to find one. We'll go down one more row real quick. Kind of wanted to show you an exclamation point, but we don't have one. So all these doctors take Medicare assignment. You can go to any of them. You can call them, make an appointment. You don't have to get pre-approved. You don't need a referral. Now, someone like a cardiologist may want a referral. They may want you to have gone to a primary care first so they can determine that, yes, you do need to see a cardiologist. But outside of that, there's no restriction. So you don't have to do it unless that doctor requires it themselves. So here we're in doctors and clinicians. Let's go to hospitals. So when we click on search, and same thing. So we're on a 15, 25 mile radius. And again, it'll give you the map, just tons of hospitals. And again, easy to see, easy to use. Now here's one that says Bay Pines VA. So a VA hospital, it says, please note at this time, Medicare won't pay for services at this hospital except in a very limited circumstance. And why is that? Because it's a VA hospital. So VA is going to pay in that hospital. So if you're on regular Medicare, you're not generally going to go to a VA hospital unless you have VA coverage. Sometimes people have VA coverage and Medicare because they want to be able to go to hospitals other than VA hospitals, but regular Medicare folk can't go to VA hospitals and have Medicare pay for it. But you can see everything else doesn't say that. So it's just simply on a VA hospital is where. And then you also have star ratings and patient survey ratings. Gives you a pretty good, overview of what would work for you. And, let's look at home healthcare services real quick. Same thing. It just gives you a quick list of everything in your area. And it just makes it easy to find what you're looking for. So pretty simple to do. And again, with original Medicare and a supplement, you don't have any restrictions. It makes it easy to go where you want to go and do what you want to do. And whether it's here or whether it's in Alaska or California or Maine or Illinois, it really doesn't matter. You can go to any doctor anywhere in the country. And all you got to do is find them on Medicare.gov, call, make an appointment. Your Medicare will cover it. Your supplement will cover it. No questions asked. Makes it very easy to do. So I hope you found this helpful. Certainly be happy to help you with your Medicare. It's what I do for a living. And we'll make sure we get all your pieces in the right places. Right now, I'll show you how to download my book, Medicare Made Clear. It's absolutely free. Great resource to have. Stay tuned. I'll show you right now. Have a great day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit MedicareOnVideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit MedicarePriceCheck.com, put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be. And likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously take advantage of all the information on my website at MedicareOnVideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.